Here at the Consello Spark Summit 2026, it's about leadership, it's about navigating relatively extraordinary times from a geopolitical context, but it's doing that with grace and focus. And we've got Q Delara to talk about all of that. Now, recently gone public, MiniMed. It was formerly Medtronic Diabetes. How is life in leadership as a publicly traded company?
Well, first of all, thank you for having me. But let me tell you a bit about MiniMed. We are a diabetes technology company, and we really serve patients around the world that need insulin to stay alive. And for about 37 million or so people who manage their diabetes this way, they need to take 8 to 10 injections a day. And so we really build technology that really alleviates that burden and helps them dose insulin with automation. So that's what we do. We're uniquely positioned because we're actually the only company that has all the components of this system. The sensors, the dosing devices, whether that's a smart pen or an insulin pump, and then the special secret sauce around the software that drives all of that automation. So that's what we do. And we're really excited to become a public company. It used to be a public company before Medtronic acquired MiniMed back in 2001. And so for the community of people in diabetes, they know our brand very well. And we're just excited to be able to focus every day on diabetes innovation.
So talk to me about that innovation, what the recipe is. You're not going to say the secret source of the software, but there's also a process of getting things through FDA, getting clearance. How has that been? Because you have got a new product onto the a way of making sure that people take this safely and easily, but with the right scientific backing.
Well, if you go back in time, the state of the art maybe 10, 15 years ago was really what people call multiple daily injections. So the person with diabetes has to take an insulin pen and dose themselves with insulin. So they need to know when to dose, how much to dose. And that's actually really complicated because dosing insulin or managing your glucose has a lot of factors. It isn't just food. It's stress, it's hormones, whether you're sick, all sorts of factors, 42 of them. So you're making hundreds of decisions every day. So what we do with our technology is we automate all of that. We have a sensor that measures glucose in your body continuously. And we have a special algorithm that says, hey, if your glucose is rising, we think you're eating. And this is how much insulin to take. And we deliver insulin doses every 5 minutes. So it's like a continuous machine that's doing it on your behalf. And so you're not poking yourself 8 to 10 times a day. You just wear the pump and it does the work for you.
How has the landscape changed with the innovation of GLP-1s and people managing perhaps their health? Has that affected your outlook, the trends that you're seeing in terms of number of people that you're serving, the 37 million?
Well, we focus on people who already need insulin. Now, GLP-1s are really a fantastic therapy that's available now for a lot of people that can benefit from weight loss and live healthier lives. But it doesn't cure diabetes. And so when insulin comes in, if you need insulin, then we come in. That's where our technology gets involved. And so what we focus on is insulin delivery for type 1 and type 2. GLP-1s don't remove the need for that. And actually, when you look at the adoption of this automation, it's really in the low double digit globally. So while the technology is so effective in treating and managing diabetes, most of the world hasn't adopted it yet. And so that's really the challenge ahead of us is how do we make people aware of the therapy? How do we help them get on therapy, stay on therapy, and really lead better lives without the burden of daily diabetes management?
So how are you educating populations outside of the United States in particular? There is a need. How do you make sure that they know that yours is the product, the innovation that they want to be using?
Well, really, we are in 80 countries already. We have an install base of over 640,000 people globally that use our therapies. And it starts with clinical evidence. You've got to be able to convince physicians as well as payers around the world that your therapy works. And you do that with science and, clinical data. And that's what we do all day long. It's not just getting approval. That's just the start. But you actually have to explain to physicians and patients around the world that this is how the therapy works. This is how you use it. This is how you incorporate it into a clinic's workflow. And that's an ongoing process. So generally speaking, the level of automation in our technology is you typically see that in the developed world because health systems have funds that can reimburse those therapies. In the developing world, it tends to be out of pocket.
Yeah.
But that's changing as people realize that, I don't know if you know this, but 1/4 of US healthcare is related to diabetes.
Oh.
So it is a disease that if you can really prevent early on all the downstream complications of cardiovascular disease, kidney disease, eye disease, amputations can be alleviated if we manage glucose up front.
What you tell is so revealing, that 1/4 of the spend in the US is related to diabetes. How is that message getting across to the general investor base? Because you have an extraordinary amount of key stakeholders, whether they be your employee base, who are helping with the innovation, the users, 37 million people that could be using and adopting technology. Then there's an investor base that to them is quite niche unless they have a family member affected. How has that been, that storytelling moment, and how are you seeing it increase as we think about automation, AI, healthcare a little bit more?
You know, the surprising thing is that investors that understand diabetes know it extremely deeply. I mean, they will know that you have a clinical trial that just got published on FDA, clinicaltrials.gov, and the FDA website before your employees even know that you're doing it. I mean, they are very sophisticated. They know the patents, they understand the companies. They have had incredible returns from diabetes. It's a very high growing market. And so it was very surprising for me to learn that. So they're not journalists. They are actually very deeply knowledgeable about diabetes, the technology, and where the future is going.
Where is the future going? We've got a minute or so left. You just took us 10 or 15 years back.
Yes.
Take us 10 or 15 years forward.
Well, MiniMed is solving a dual problem. So when you manage diabetes, what's hard about it is you can't go low because that's dangerous, and you can't go high because that's what drives complications, brain damage, heart disease, etc. So you got to kind of stay on an even keel, and that's really difficult to do. So we are trying to solve a dual problem. The first one is, how do we keep people at a steady level? We call that time in range. You don't want to be too low, too high. So you want to be at in range for at least 70% of the time. That's the guideline from the American Diabetes Association. If you don't have diabetes, you're 95% time in range. So just to give you a sense. Wow. So that's very hard, and we use automation to do that. But the second problem we solve for is you're making 180 decisions a day if you have diabetes.
That's exhausting.
If I'm going to eat a panini, how much should I dose? If I have a meeting and my glucose is going to go up, I don't want to be confused. There's so many factors that go into that. We want to remove that burden as well. So where it's going is we are trying to be the self-driving car of diabetes. A self-driving car takes you from A to B. You don't have to drive. We're trying to do the same thing. Just wear our device. The automation will do the work so you don't have to.